Hey there, welcome to the Iridology education presentation today. Reflux, indigestion, excessive burping, stomach insights through iridology. Just before we get going, I would just love to know a couple of things from you. Number one, I want to know, are you IPA certified? Or do you have formal iridology training, or are you new to iridology? Just drop that for me in the chat box. That's going to help me shape this as we go. Of course, I've got everything planned out, but if I see that everybody here is IPA certified, then I can go deeper. If I see that we've got some new people, then I need to keep it a little bit lighter. Chris has some training. She's one of my students. Alva's still learning. Okay. Anybody else want to weigh in on this? It's great to have the interaction. Currently studying at Irish School of Herbal Medicine. Yeah, Tony, yeah, so good to see you here. And Maria, glad you're with us today. Okay, so I'm not going to go terribly deep because we've got a lot of people who don't have that IPA certification base. And so I need to make sure that everybody gets something out of today. That sound okay by you? If that sounds good, give me a thumbs up or something to let me know that you are totally on board with this. Yes? Good. This is good. Tony says yes. Lovely. Lovely. Okay, so again, welcome. I'm excited to have you with me today. If there's one thing I love, it is teaching, and particularly teaching holistic health. I'm Judith Cobb. You might have already known that since you signed up for this class. And I'm just excited to have you with me. This is an interactive webinar. The more you participate, the more you drop comments in the chat box and answer questions for me, the more you're going to get out of this. So I'm also going to encourage you, if you're not doing this on your phone, if you're not with us on your phone, if you're on another kind of a device, I'm going to encourage you to put your phone in airplane mode. Let's minimize distractions, because I want you to get as much benefit out of today as you possibly can. You've prioritized spending 60 to 90 minutes with me rather. And so I want you to get the most out of that. Does that sound like a good idea? Let's really be engaged here. All right. I also want to know, how many of you are currently working with clients? Amanda is? Okay, so I can only see 5 of you, and there's about 12 or 14 of us here. So maybe drop a comment in the chat box as well. If I didn't see you waving, saying you're working with clients, not yet. Chris is working with clients, excellent. Okay, Tony says not yet. Stacy says yes. Marika says no. Okay, so we've got some yeses, some no's, starting to, but not charging. Oh, Maria, we need to have a conversation. Yes, I'm wagging my finger at you. Right, because if you're starting to see clients, that means you're starting to charge. Oh, if you were in my Dynamic Iridology course, I'm going to come back to Chris. Chris, do you remember how I nag you about charging for your services, even when you're a student? And Chris says, I believe you should charge. So Maria, and Chris remembers me nagging her too. So Maria, I'm lighting a fire under you on this one. You should be charging something. Those of you who are seeing clients, and those of you who aren't, do you know people who are suffering from these kinds of symptoms? Reflux, indigestion, they burp a lot. There's some kind of upper GI thing going on. And maybe they're just popping antacids like crazy, thinking that's the answer. Hint, it's not. Yeah, a lot of you are seeing that. Fantastic. Thank you. So Chris says yes. Amanda says yes. Tony says yes. Yeah, really, really common problems. Really common problems. Chris says it. Oh, Maria, this is for you. Chris says it's a disservice to not charge. Clients need some skin in the game. Okay. So Maria's shaking your head saying, I know. Okay. All right. We're gonna let that rest. We're not gonna put Maria too much on the hot seat with that one. But Maria, thanks for tolerating our little bit of friendly pressure there. One more question before we begin. Do you already have a college level anatomy and physiology course to your credit? Now, it might be through massage, it might be through a herb course you did, it might be through a nutrition program you did. Maybe you come from a nursing background and you've got A&P like up to here. We've got that. Yeah, yeah. Okay, good. Oh, I think that is so important. I really give my head a shake when people think they can do iridology professionally without understanding how the body works. That just doesn't make sense to me. So I'm going to here's how our class is going to roll out today. I'm going to take a few minutes to introduce myself and share my own journey in iridology. Since many of you are new to me, this is exciting to have so many new names and faces with us today. I'm so glad you're here. And then we're going to do a bit of stomach anatomy and physiology in case you either don't have A&P or maybe it was so long ago you've forgotten, right? For some of us, that is the case. And then we're going to learn about 2 specific iris markers, and we're going to look at tons of examples. My goal is that by the end of our time together today, you're going to have a much clearer understanding of iridology in general and how the eyes reveal stomach tendencies. Sound good? Is that what you came for? Maria says she's got a dietetics background. Oh, Maria, that's exciting. That's exciting. We're glad to have you moving over to the holistic side. We really are. We're not going to have time to go into specific protocol creations today, or necessarily organ interactions, like how the liver is involved and how the pancreas is involved in all that. We're really focusing, lasering in on stomach, because we just don't have enough time to do all of it in an hour, right? Do feel free to type comments and questions into the chat box as we're going. I will do my best to answer as many of them as I can, as long as they fit the scope of where we're at and where we're going with today. I certainly cannot answer individual case questions that would be sort of diagnostic or prescriptive. That is not something we do with iridology, and it's not something I would do in a public forum as well. Alrighty, are you ready to dive in? Yeah, yeah? Those, like I said, I can only see a few of you on my screen, and I've got it. Oh, you know what? Maybe I can make this bigger. I can make it bigger. Oh, let me make this much bigger. Let me make this much bigger. Just give me a second here. Oh, that's exciting. So some of you have your cameras turned on. Thank you for that. And some of you are being shy. Got it. Okay. And I know if some of you actually don't have your cameras on, you're probably multitasking. And again, at the beginning, I said, turn off your smartphone if you can, focus with me, folks. Okay. The information today is meant only for your education. It is not meant to diagnose or prescribe. And you are responsible for any results, good or bad, that you get from using this information. Chris says she's eating lunch. And Chris, you didn't make enough for me. Okay, we'll forgive you today. We'll forgive you today. But I'm going to end up on your doorstep one day, Chris. Yeah, and you're going to give me some lunch. All righty. So about me. I am not the new kid on the block. This iridology thing isn't something that I just learned 2 years ago and I am just all excited about it and I'm trying to get out there and be an influencer. No, that's not me. I don't teach at that sort of fluffy level at all. Way back in 1979, I had some health problems. I was a young adult back then. You can try to figure out some math from that. And those problems weren't life-threatening, but the doctors really didn't seem very interested in helping me. They really didn't seem to care. And I was kind of put off by that. I was a pretty self-righteous, headstrong young adult. And like, if you're not going to pay attention to me when I'm here, and if you're not going to answer my questions, then I'm not coming back. I'll find somebody else who will help me. So that's when I went to the the health, natural health side. I like to call it the dark side sometimes because that's how my extended family characterizes me. That's when I started studying herbology. And back then we only had Bernard Jensen iridology. I also started apprenticing with a local healer and I studied with her from about 1979 to 1981. She had studied with Bernard Jensen at his Escondido, California ranch. So she was a first generation iridologist from Bernard Jensen. Back then, there were very few herbalists and iridologists here where I live. So by 1981, I was coaching people. I was teaching them how to regain their health using herbs and supplements and food and lifestyle. And I was really a young adult. I was like 22 or 23, really young. It's what I did instead of finishing university, right? And this was way back before the internet was available to the public. So people couldn't just go and Google something and use Dr. Bing and Dr. Google, right? They actually had to go to a health food store, and they were few and far between, or they had to find somebody sort of underground like me who was kind of doing this on the slide. But after a few years of doing this work, I got really disenchanted with iridology. I'd been taught from the Jensenian model that if we did the right herbs, if we did the right diet, if we did all these holistic things, that the eyes would change. We would see the patterns and the colors in the eyes change to show that we were making progress. But that never happened. My clients were feeling better. They were getting good results, and they were telling their friends about me, but their eyes weren't changing. So I was just about ready to leave iridology altogether because it was not working. But you know what they say, when the student is ready, the teacher appears? That's when constitutional iridology came into my purview, and it changed absolutely everything. This style of iridology just made sense. It helped me understand clients faster. It helped me understand clients' root cause. It helped me create better programs for them. And we got even better results, which meant we had much better client retention. Right? I'd see them for 4 or 5 appointments, typically at 1-month intervals. We'd build the program. We would work with things. We would shape things. And then they were feeling great. And then they would disappear, often for 4 or 5 years. And then, you get older, things start to happen, your life changes, maybe you forgot all those good things that I taught you, things start to fall apart, you have more symptoms, and those clients would start coming back for the second wave. And we'd do the 4 or 5 appointments again, whatever they needed, and then they would go away, and they just do this ebb and flow. It's a constant dance with them. It was absolutely beautiful. I've got clients who started with me in the Jensen days and are still ebbing and flowing with me, and it's been 45 years, which is amazing. How many of you would like to have clients coming back for 45 years? Yeah, that's what we call a stable business, right? That's a business model. Now, I've been studying since those early days iridology. I've studied with 8 different teachers. I've studied herbology with I don't know how many different teachers now. I've studied nutrition under a handful of teachers as well. And anything else that seemed at all relevant to helping my clients, I have brought it in. I've been honored by IPA. In 2022, I was voted the Instructor of the Year, which just, blew me away. I had no idea that was coming at me. And in 2024, they voted me the Iridologist of the Year, which again, blown away, totally honored. I am one of only 11 level 3 certified iridology instructors through IPA. So that's pretty cool too. IPA makes us do upgrade every year. We have to do CEUs, and these are my most recent badges showing that I am up to date with all of my certification processes. In all of these years that I've done this, I have authored and self-published several books, which are all out of print except for one. And they were Pregnancy Naturally, because pregnancy and fertility are something I absolutely adore working with. And we'll just admit another guest. There we go. The Herbal Birth Kit Handbook, Healthy Kids Naturally, The Essential Guide to Nature's Sunshine Products, Biokinesiology and Color Therapy Level 1 and Level 2, and the Dynamic Iridology Textbook, which is available only to my students who are in the Dynamic Iridology course with me. Often those books were the result of teaching courses. So I've also taught a level 1 20-hour herbal training for home use. And those students, I taught that for many years, and those students were so excited about the course that they kept asking for more. So I created a level 2 for them, 16 more hours of more advanced herbal practical usage in the home. I've also designed and taught biokinesiology and color therapy level 1 and level 2. For a while, I was a certified prenatal educator. That was a ton of fun. Totally loved that. And of course, I still do teach the Dynamic Iridology Assessment System, which is a course that includes all of the IPA level 1 and level 2 core curriculum. So all of the curriculum you need to go through the certification process with IPA. I'm also a holistic health professional with nutrition with the Canadian Association of Holistic Nutrition Professionals and the Canadian Association of Natural Nutritional Practitioners. And I am a professional member of the Alberta Herbalists Association. And all of these organizations require CEUs. They're not just pay a fee and you get to join them. You have to have proof of education, and then you have to do CEUs every year, which I really, really do appreciate. So just dropping this in the back of your brain here, the next Dynamic Iridology Assessment System online course will be starting on September 23rd. And if you are interested in being notified as to when the priority registration opens, that's the registration before it goes open to the public, you want to either grab this QR code or you want to grab this URL that I've just dropped into the chat box for you. Okay. Sharon Bimrose is one of my graduates of the Dynamic Iridology course. She says, as a naturopath and herbalist, I've always used iridology in my practice. However, Judith Cobb's Dynamic Iridology course has given much needed structure to the knowledge I already learned. This has certainly reduced the time required for prioritizing a treatment plan. Dynamic Iridology has, without a doubt, been a huge game changer to my practice. I love that, love that, love that. All right. Why do you want to learn iridology? Some of you do it. Some of you are curious about it. So I want to know, why would you like to learn iridology? Why has it caught your interest? Those of you who are studying, what are you loving about it? What are you loving about iridology and how it works with what you do? Love to see that in the chat box here. I'm going to share my whys that I love it in just a moment. As soon as I see some of you with your lightning fingers, put your messages into the chat box. Like I said, the more you play with me in that chat box, the more I'm going to give you. The internet must be very slow because the messages, it's a great connection builder when addressing clients. Oh, it is a huge connection builder. That's great, Chris. Maria says it helps personalize care. Oh, yes. What the body needs is different for everyone. The eyes show you that. Yes, 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 yes. Alva says it helps with knowing the best way to help the client. Amanda says it's a tool to make treatment protocols. It can certainly guide that. Excellent. Tony says it's non-invasive overview of potentials. Absolutely, absolutely. Chris corrected, not addressing, but assessing. But it's both. It's both, right? It helps you know how to address your clients, but it also gives you that insight to help you assess. So I love iridology. Those are so good, so good. Just very interested in medical alternatives, says Marika. I hope I'm saying your name right. It is also very chat effective when lab tests are so expensive. Yes, yes. Or cost effective. Well, it does both, doesn't it? It creates conversation with you and the client, which you need to have, but it's also very cost effective. Yeah, brilliant. Those are brilliant answers. You obviously all have great insight as to why iridology is powerful. I love it because it does help me do a faster assessment with my clients. I love it because it is more accurate. And I'm speaking specifically of constitutional or dynamic iridology over Jensen. And I'm not dissing Jensen. I just want you to know I love Dr. Jensen, but the constitutional is much more accurate. It creates better and faster rapport because you're speaking with your client about what you're seeing in their eyes, and you're connecting what you see in their eyes with their symptoms. So that guides the questions you need to ask so that you can get the answers you need to address those symptoms, right? So it helps to complete that that conversational circle, if you will. It eliminates the need for an intake form. You always need a release form, but I no longer use an intake form. I have an intake form. My clients never see it. I will add information to that intake form as we're doing the iris assessment and as I'm asking questions and getting answers, but I do not give my clients a questionnaire to fill out. I think questionnaires are cruel and unusual punishment. Do you agree with me? Do you love filling out questionnaires? I've never met a client who complained about not having to fill in a questionnaire. Just saying. Just saying. Oops. That skipped one for me. Let me come back here and make sure we've got everything we needed here. We did. Okay, so here's our little A and P review. Hopefully this is just review for you. The alimentary canal has one primary function with many stages. Its primary function is to move food from the mouth to the anus. And everything between the mouth and the anus is not necessarily digestion. Some of it is digestion, but some of it is assimilation. Digestion is the breakdown of food, and it happens primarily in the mouth and in the stomach, with a tiny, tiny bit happening in the duodenum or duodenum, depending on how you say that where you live. Assimilation is the uptaking of nutrients or the absorption of nutrients, and this happens mostly in the duodenum, the jejunum, and the ileum, with a little bit happening in the large intestine. Elimination is where the residue is gotten rid of. Waste products accumulate in the rectum, and elimination happens via the rectum and the anus. So using these definitions, which I realize are super simplified, the physical organs of digestion that we are focusing on are the mouth and the stomach. It is true that there are many things that affect the entire alimentary canal, and digestion certainly can and does affect assimilation and elimination. It's really important when we're working with clients that we take time to teach them about the digestive tract. So many of them don't have a clue. Have you noticed that? They think that everything that goes into their mouth, they think that that whole alimentary canal is all digestion. And they don't realize the different steps and stages and the importance of isolating the different steps and stages. Our clients often only know they eat and they poop and something happens in between, right? So case in point, and this is not to shame anyone. And I just want to make this clear. I was teaching my Herbology 1 course. This is probably 30, 35 years ago. And we made a point of discussing anatomy and physiology as we were discussing the herbs, because I needed my clients to have that fundamental basic understanding of their bodies so they'd understand the actions of the herbs. After one class, a woman in her mid-30s came up to me and she said she had learned something that was just blowing her mind. She had previously believed that the small intestine made urine and the large intestine made poop. Okay. She had no idea what the kidneys did or how they would tie in until we did a kidney unit, and then she understood that. But she was in her mid-30s and had no understanding. And so, again, not shaming anybody, but we need as practitioners to understand what is our client's knowledge level so that we can start teaching them from where they're at and build on that to help them understand what we are doing with them. This is really important stuff. Because we are first and foremost educators, right? We might call ourselves healers, but we really don't heal anything. We simply teach, and when our clients implement, they become their own healers, right? So we can't assume that our clients know everything. Have you come across that with your clients, that they don't understand their body very well and that they need you? Amanda's nodding her head yes. They need you to just gently bring them up to speed, give them that bit of education. So important, so important. So growing up, I was taught that digestion started in the mouth. Now, you and I know that's not really true. So where does digestion actually begin? If it doesn't start in the mouth, where does it start? With smell and eyes. Alba, brilliant. Sensory, yes. And so which organ is processing those senses? Which organ? The brain. Yeah. So digestion starts in the brain. The senses send information to the brain, and the brain says, ooh, that smells good. I think I want some. Or, dang it, they burned supper again. I think I'll go out, right? That's the brain's job. So the brain and the nervous system actually get called into action at least twice for digestion. So again, when you're smelling something delicious or you're heading out to your favorite restaurant, that starts the changes. If you're in a safe place, which I think all of you are, I don't think any of you are driving right now, take a moment. If you're comfortable, close your eyes and imagine you're holding a fresh lemon in your hands. Feel the bumpy skin, and it's cool. Now imagine cutting into it and you can smell that burst of lemon citrus. Anything happening in your mouth? Are you feeling those saliva glands kind of do the little spazzy thing? Now imagine you're going to cut a wedge and you're going to suck on that wedge. Did that just make you pucker a little bit? Just a little bit? Did it? Mouth is watering. Tony says, yeah, right? Right. That is exactly how digestion begins, right? So that's a great example of step one, which we see here, stimulation, taste, and sight, not just eating it. The thought gets the brain's anticipatory centers working as the brain imagines what the food is going to taste like. Step two is the taste receptors on the tongue send signals via several cranial nerves, specifically facial nerve 7, the glossopharyngeal nerve number 9, and that very popular vagus nerve number 10. Those 3 nerve pathways are sending messages to the brain. You already likely know that the vagus nerve is the major parasympathetic nerve connecting the brain to the GI tract. Notice parasympathetic responses are what need to be activated to digest food. If you were with me last month, we actually talked about many of the body functions of the sympathetic and parasympathetic and what they affect, including digestion. And you'll either recall or maybe you already knew that the parasympathetic activation is necessary for rest, digest, and sex. Okay. Step 3 is the cephalic response. This is where the hypothalamus and the brainstem activate the vagus nerve again to stimulate the production of saliva, stomach, and pancreatic juices. Finally, we get to step 4, which is the gastric phase. Here we've got stretch receptors and chemical receptors in the stomach wall that detect food and send signals via that very busy vagus nerve again, and the enteric nerves from the stomach lining to the brainstem. The enteric nervous system is a vast, semi-independent network of over 100 million nerves lining the gastrointestinal tract. Most of us don't pay attention to the enteric nervous system, but it is so important. And this system stretches from the esophagus right to the anus. It's often called the body's second brain. It continuously manages the digestive processes like motility, enzyme secretion, and local blood flow without requiring any input from the brain. So it kind of is independent. It does a lot of this stuff without involving the brain. The ENS is made up of 2 main networks. The neurons are the plexuses that are embedded directly into the walls of the GI tract. The first is that myenteric plexus, located between the muscle layers of the digestive tract. This network primarily controls gut motility, including the rhythmic contractions known as peristalsis that push the food along. And the one we're really interested in today is the submucosal plexus. This is situated closer to the inner lining of the gut. This network regulates local enzyme and hormone secretion, and it controls fluid absorption, and it adjusts the blood flow. So we can see that having food in one's mouth is often an important stimulus for digestion, but that's not where digestion starts, as we just proved with the lemon experiment. Now, let's say we've been thinking about supper, and it's going to be a good meal. You've been planning it. Maybe you're going out, you know exactly what you're going to have, and your mouth has been watering all day, and your tummy's been rumbling all day in anticipation. And it's your favorite food, and it's made just the way you like it, but your mouth is not healthy. You've got teeth that are missing, they're severely decayed, they're broken, your gums are inflamed. You know, if your teeth are bad, you can't chew well, or maybe not at all. Chewing might be painful. These gums, even your gums or your teeth might hurt. This can provide entrance places for infections. This is an important thing for us to be aware of. I know it's not stomach oriented, but if we don't chew our food well, the stomach can't do its job either. And pureeing the food is not the answer, because when foods are pureed, they tend to just get swallowed and they don't get mixed with the mouth enzymes, right? So we need to take care of our teeth. Gingivitis affects over 50% of the North American population. And it affects children as young as 6. This is scary because gingivitis has been linked to an increased risk of cardiovascular issues, such as atherosclerosis. And it can also make blood sugar control more difficult for people with diabetes. This is really, really important. And it's an important thing when you're working with a client and they've got digestive concerns to ask them about their oral health. Ask them about their dental care habits. Do they brush? What do they brush with? Is it a manual toothbrush? Is it an electric toothbrush? Do they floss? Do their gums bleed? When was the last time they saw the dentist? When was the last time they had their teeth cleaned? And it's not to shame anybody. It is simply to help you understand, again, what is their knowledge level and what is their ability level? Is this someone that you could teach a little bit about oral health? There's a really good book, and I should have brought it down from my bookshelf, but I didn't. Give me just a half a second to find it. This is a really good book, Dental Herbalism. So you might want to consider adding that to your reading list. Because, you know, we can talk about stomach all we want, but if the mouth isn't healthy, the stomach almost doesn't matter. Let's assume you've got healthy gums and teeth. Beautiful smile, nice healthy teeth. Now it's time to eat, but you're rushed or you're stressed. You inhale your food on the run because you don't have time to sit down to calmly eat for 20 to 30 minutes. And when I say sit down calmly to eat for 20 to 30 minutes, I want you to hear that as you don't have time to chew your food thoroughly. Years ago, and I'm going to ask for you to admit guilt here. I'm going to tell you a story and see if you've ever done something similar to this. Years ago, when I had a clinic that was not in my home, and I only worked afternoons in the clinic, one day I was running a little late, so I did drive-through for lunch. Now, I know maybe not the best choice, but I had a chicken burger instead of a beef burger. You know, I tried to make better choices at that drive-through. I picked up my food. I pulled out of the from the drive-through and onto the road. I got to the first intersection, which was maybe 200 feet down the road. And I realized I'd eaten the entire chicken burger in that length of time. Maybe less, maybe 2 minutes. Any of you ever done that where you've eaten so quickly, you pretty much didn't even taste the food? Are you guilty? Occasionally, maybe. Tony says yes. Tony, thank you for being honest. Thank you for being honest. Yeah. 5 minutes between clients. Yeah, Amanda, right? Jamming it in there. Just trying to get something in so you don't pass out on your clients, right, Amanda? Sometimes, yeah. Well, that was a wake-up call for me when I realized what I had done. And I'm pretty sure I didn't chew that burger very well at all. Yeah, so it's for even us in the industry, in the health industry, we need to be more aware of what we are doing. And Amanda, again, I'm not trying to shame you here, but if you don't take care of yourself, what kind of an example are you setting? And who's going to take care of you when your body finally collapses because you were jamming food down too quick, right? Yeah. So that's all I'm going to say. No more, no more of that. But it's something that we all have done. And it's something that we all need to be aware of to maybe not do so much of. Teeth mechanically break our food down. Now, I want you to think about this. If I have, do you know the difference between Lego and Duplo? Lego are the big kindergarten sized blocks. Duplo are literally 25% that size. They're much smaller. If I give you 2 Duplo blocks, how much fun are you going to have playing with those? That's all you've got is 2 6-bump Duplo blocks. Yeah, not much, right? Now, if I give you a handful of Lego that will make the size of 2 Duplo blocks, you have some 1-bump Legos, some 2s, some 4s, some 6s. How much fun are you going to have with that? Is that going to be a little bit more fun to have that much little Legos over the 2 Duplos? I'll tell you, they're equally painful to step on in the middle of the night if you've ever had children. But some of you know what I'm talking about. But the handful is a little more fun, isn't it? Because at least you can do something with it. That is the difference between not chewing your food, that would be the Duplo, and chewing your food, that would be the Legos, right? We need to teach our clients to chew their food to be little Legos, preferably more 1 and 2 bump Legos than 6-bump Legos. So the teeth mechanically break down the food. Salivary glands make 1 to 2 liters of saliva every day. Saliva isn't just to moisten your food, although that's an important part of it. What it does, it cleanses the mouth. It also protects the teeth. The saliva carries minerals that help to remineralize your teeth. So the saliva is really important. Saliva is alkaline, and all of the salivary glands make the same stuff, but in different ratios. So the pH of the mouth needs to be between 6.2 and 7.6. It's really pretty close to neutral usually. Amylase, which is made in the mouth, digests your starches. So lysozyme is antibacterial. Salivary lipase starts fat digestion. Peroxidase is an antioxidant. We also produce mucin, which is a protein and it lubricates the mouth. Bicarbonate ions to maintain the pH of the mouth. Electrolytes, and the mouth is where the chemical breakdown of most carbohydrates happens. So if we don't chew our carbs well and they go through the intestinal tract, we're going to end up with more gas as those carbs ferment in the gut. Oops, I forgot I had all of these listed there. Okay, there we go. The esophagus connects the mouth to the stomach. We have the lower esophageal sphincter. This is where we're going to start getting into digestion, folks. So I'm glad you're still with me. This senses stomach acid, and it relaxes to open to let the food in to the stomach. And when there's enough stomach acid in the stomach, the lower esophageal sphincter closes tightly. If we do not have enough acid in the stomach, that lower esophageal sphincter will not close all the way. That creates a problem. Because if this little valve right here, which is not a really strong valve, but if it doesn't close all the way, it prepares the way for stomach content to backwash up the esophagus. That is reflux, right? Often people who have reflux, when they go to the doctor, they're just given a PPI, a proton pump inhibitor, which reduces stomach acid. But 9 times out of 10, reflux is caused by low stomach acid. So you neutralize that stomach acid. It's not going to help that sphincter function better. When we get anything backwashing from the stomach up the esophagus, it's going to feel like it's burning, because it doesn't have the right pH to be in the esophagus. Does that make sense? That makes sense? Fantastic. Fantastic. The stomach has a whole lot of layers. The stomach should have a pH of between 1.5 and 3.5, so it's very acidic. And we've got all of these different layers, right? So we've got the outer wall, we've got the internal musculature, we've got the submucosa, and then we've got the mucosal lining. And the mucosal lining is the one we are going to be paying attention to here. I'm just trying to let another guest in. There we go. All righty. Let's look at this mucosal lining. Villi. How many of you remember villi from your A&P? Yeah? Fantastic. So here is the villi. So again, we've got the outer layer coming into the mucosal layers, and then we've got these villi. So the inside of the stomach looks kind of almost like shag carpet. All these little projections in there that are tightly packed. And along these projections, we have various different cells, right? We've got the some endocrine cells. We've got some endocrine cells here. We've got the chief cells, which are the purple ones, and they're secreting pepsinogen, which activates pepsin for protein digestion. We've got the parietal cells, which are the blue ones. It's hard to see the blue ones in here. These secrete hydrochloric acid, an intrinsic factor for B12 absorption. And we have to have mucus cells here. So we've got the neck cells and we've got the surface mucus cells, because the stomach is only protein. It's a muscle. And we've got all of these things that are designed to break down proteins. If we pour these enzymes and chemicals that our body makes directly onto the stomach lining, the lining is going to get digested. And so we need to have that mucus barrier in here to protect the stomach lining so that all of these protein digesting chemicals, if you will, can do their job without damaging the stomach. Okay, so now that we've got that basic understanding, let's do some iridology. This is the Dynamic Iridology Assessment System map. What do you notice about this compared to the map that you likely are using? Simplified. Yeah, Maria, absolutely. Not nearly as cluttered. When you look at the organs and the tissues that are shown on this map, do you recognize that the only things that are on this map are things that have an actual metabolic impact? So we're not concerned necessarily about the hand or the fingers or the earlobe. We're concerned only about things that have a metabolic impact. And that's what constitutional iridology is all about. It's all about how this body works, right? When we look at this, you're going to see a lot of similarities to the map you already use. You're going to find that the lung and the heart are in the same place, the brain is in the same place, the sinus is in the same place, the stomach and the intestinal tract are in the same place. We've just left out all of the other stuff that we don't need 90% of the time. So here we see the stomach is right against the pupil. Okay, that's in constitutional iridology, we call this zone 1 because we've got 7 different zones in the eye. So zone 1 is the stomach zone. All right. So zone 1 in this iris is from the inner pupillary edge to right here. Can you see when you look closely that there's a slight color variation between this and this? A slight maybe textural variation as well. If you can see that, give me an I see in the chat box. Let me know that you can see that variation. That you can see where zone 1 is, where the stomach zone is. Yes, yes, yes. Oh, I love this. I love this. Okay, great. So good, so good. This is the stomach zone. Now, there's no one marking that is a guarantee of anything, nor is the presence of any markers a guarantee of anything. We simply are looking at the inherent predisposition. So when we look at this eye, we cannot say you have stomach problems. But if our client has come in saying, I have heartburn all the time, and we look at the eye, we will understand why they have that problem. Or maybe they've come in for a different issue, but they're giving us verbal clues that are telling us that they probably have some stomach issues. When we see the eye, then we can ask them, we can connect those clues to what we see here. People can have many digestive markers and have no symptoms at all. It could be that they're too young for the symptoms to manifest, or it could be that they are doing enough things right, either by default or on purpose, and their body is not needing to have a symptom there. It is also very possible to have digestive concerns and have no markers. This person, any client, may have been born with a very robust stomach, but they might have done a lot of things to abuse the stomach. The eyes will not change to show that abuse, but the symptoms will. And so the eyes are showing us the inherent potentials, what this person's genetics are all about. Does that make sense? Is that new to any of you? No? Okay, good. So this again is why it's so important to have that foundation of anatomy and physiology before we even start learning iridology. Let's look at a couple of markers. This is a 17-year-old girl. And again, this marker might be a little hard to see without magnification. So I hope you're working on a good sized computer screen, not on a tiny tablet screen. When you look at the very inner edge of this, can you see that it looks like somebody has snipped little bits out of the edge? This inner edge is pretty rough. We call these comb teeth. Everybody doesn't have comb teeth. You will rarely see this in a true brown eye. And there's nothing you're going to do to get rid of these comb teeth. This part of the iris right along here correlates specifically to the stomach lining. Specifically to the stomach lining. Now, this young lady had no digestive concerns. I had been caring for her for about 3 years before she was even conceived, because her mom and dad were coming in to work with me in order to optimize their health to conceive this girl. Right. And so I knew what the diet was like at home. I knew what we'd done with the parents. And so this daughter, this young lady, had inherited the potential risks of stomach issues. But because the diet at home and the lifestyle at home were really, really nice, she didn't have to have any symptoms. She was also young. So might be that when she's 35 or 40, if her diet and her lifestyle slips, she could end up with symptoms. So this comb teeth marker suggests a greater predisposition to an inefficient or insufficient stomach lining, which means an increased predisposition to a higher pH, so closer to 7, not that 1.5 to 3.5 that we really want, but that should be to a lower pH, I believe. I always get my highers and lowers mixed up when I'm talking acids. So she has the ability to have poor production of HCl and pepsin, because the stomach is smart. If she's having a lousy diet and she's not protecting that stomach lining to allow for the mucus secretion to protect things, that stomach is not going to secrete enough HCl or pepsin. It doesn't want to digest itself, right? So think back to what we discussed a few minutes ago about how the stomach lining is structured, the different roles of the different secretions. And if the stomach lining is compromised, if it is truly compromised, what kinds of symptoms might you see? So if the stomach lining is compromised, she doesn't have the mucus secretion she needs, what kinds of symptoms might you see? Pain? So pain where, Tony? Burning? Burning where, Maria? This is called holding your feet to the fire. Stomach lining could feel like it's burning. It might. Pain in the stomach area, indigestion. Indigestion will make sense. So what does indigestion mean to you, Tony? And I ask that because our clients will use terms like this, and we need to understand what their definition of them is. Because as health professionals, we have a clinical definition that may not match the way our clients think of it. Could have leaky gut, could lead to leaky gut. That would not be a stomach thing. That would be an intestinal thing, though. Right, Wing? Right? I love these answers. These are good. Pain in the stomach explained as bloating and cramping. Bloating and cramping from inefficient digestion, right? Food not being fully digested, fermentation in the stomach. Yes, good answers, Tony. Yes, yes, this is the depth of thinking we need to be applying when we are doing iris assessments, right? And so I would anticipate a lot of stomach gas, possibly burping. If things are also not being digested well and that's getting passed into the small intestines, we're going to see a lot of farting. And we might have protein farts or we might have carb farts, and that's a discussion for another day. But we are going to see some of these kinds of issues. And the idea of pain, yeah, we again, if we don't have enough stomach acid, if that pH isn't in that 1.5 to 3.5 range, we don't have enough stomach acid, the lower esophageal sphincter is not going to close, and we're going to run the risk of reflux, with that burning pain often coming up the esophagus, right? Another symptom that I have found to be very common with that valve not closing properly is sometimes they won't have the burning pain, but they'll feel like their throat is always coated, right? Because the esophagus is saying, this is the wrong pH to be in the esophagus. I need to protect myself. I'd better secrete more mucus. And that's where they're constantly clearing their throat. They may not even recognize it as feeling coated, but when you're with them, they're going constantly clearing their throat. And you might ask them, do you feel like you've got something in your throat? Well, no, why? Well, you tend to clear your throat a lot. Were you aware of that? No. It's a dead giveaway that stomach acid is not where it belongs. Okay, so again, you need to be able to understand the structure and the function of the stomach and then describe it. I really am a firm believer in keeping this book on my desk. So that, and it is a coloring book, and you have to know I hate coloring. When I have to color a page in here, I call my 12-year-old granddaughter over. She loves coloring, and she colors with me while I color. She'll draw and do that while I do this, and it helps me to get through this without dying in agony. And so I will pull out my coloring book and I will show this to my clients. This is what your stomach lining looks like. This is what I suspect is going on. This is, and that's why we need to do these various things that I will teach them about, right? The second marker we're looking at today, which is showing that inherent risk of digestive insufficiency, and this is a much bigger marker, it is what we call the stomach ring. So remember on that first, when we looked at the very first eye, I said, can you see that this is a different color or a different density, a different texture than this? This area where we have that tighter, more dense looking stuff, that is the stomach ring. So when we look at an iris map, it correlates exactly to this entire area. Where were we? Done that one. Oh, I have mixed up my slides here. Just a half a second. This is where we need to be. Oh, we've skipped that one. Okay, this is a good one. You can see comb teeth here as well. Okay, we'll come back to stomach ring in just a minute. My computer jumped. My mouse has been jumping a lot lately. So again, comb teeth. Age affects a person's ability to secrete stomach acid. Did you know that? Did you know that as we get older, our abilities to secrete stomach acid declines? By the time we're 35, we start that downward trajectory as a general rule. By the time we're 50, we are down by half. So when we see these comb teeth, and this is a fellow who's in his mid-60s, again, it says that genetically, he was predisposed to not being able to secrete enough digestive acids. Well, now that he's in his mid-60s, it's a pretty much a guarantee that even if he's been doing things really well, he may have a problem digesting, producing those digestive juices. So at a younger age, maybe he had the stomach bloating. Maybe he figured out there were certain foods that when he ate them, they didn't feel good in his stomach. So he learned to not eat those, right? And so we maybe if we'd known him when he was younger, we would have given him some digestive support. Here's the thing about supporting the stomach, though. Probably going to have to do it forever, because it's really difficult for the stomach that is genetically programmed to not secrete juices to ramp it up and do a good job here. Alrighty, so here we are back at the stomach ring, getting back on track here. So this is saying, again, that not just the stomach lining, although you can see we've got comb teeth here, but the entire stomach lacks the robustness, lacks the integrity that we need it to have, right? And so we need to be teaching these clients how to eat. That might sound funny. This is a client in her mid-50s. She knows that you load the fork, you put it in your mouth, you chew it, you swallow it. Isn't that how we eat? That's not what I mean, right? She knows how to do that. When we have someone that has a stomach ring, we need to teach them that they need to put their food in their mouth in the right order. First thing that should go in should be the carbohydrates. Chew them well, swallow them down. The stomach doesn't care about those. They go through pretty quick. The next thing that should go down is things that are low carb. So we're thinking your low carb vegetables, right? Your leafy salads, your cauliflower, your broccoli, your asparagus, things like that. Those can go down next. And they kind of act as a bit of a buffer. They really have almost no impact on stomach juices whatsoever. The last thing to go down should be proteins, and here's why. Solid proteins like chicken, fish, egg whites, casein stay in the stomach for 2 to 4 hours. Now, if they're in the stomach and you've got a baked potato in there as well, well, the carbs actually do have an impact. They neutralize stomach acid. So the idea of a steak and potato dinner, that's a recipe for bad digestion if you put them in at the same time, right? And so if we've got stomach proteins sitting in the stomach for too long because they're not digesting well, because there's not enough acid, for whatever reason, those proteins will begin to ferment. They'll begin to rot. And that's where we're going to get belching happening anywhere from 1 to 3 hours after they've eaten. Poorly digested proteins lead to, lead to gas. Have you ever smelled meat that was rotting? Have you? Tony has? Amanda, you never have? Okay, so do an experiment and just take a little tiny piece of some kind of animal protein, like a chicken drumstick, and leave it somewhere warm. Not in an oven, just on the countertop, maybe cover it lightly with a towel to keep the flies off it, whatever. Leave it there for a few days till it starts to rot. When people don't digest proteins, that is the smell of the gas they pass. Rotten protein, right? Because that's what's happened. That is what's happened. So if they're gas, when they're passing gas, if it's eye-watering, room clear, they go, oh my goodness, whoa, that's a protein fart. Here's another stomach ring. This is not as in focus as I would like it to be, but we can still see that stomach ring. So we know that this person, again, doesn't have the integrity in the stomach overall to be able to digest proteins well. Amanda says, for other courses, emphasis is on protein going in first to stimulate digestion, then carbs, then fats. But I've also heard of this order of carbs, proteins, fats. It is order of digestion and intake client specific then. I think order of digestion is crucial in people who have poor digestion, because they will typically find that if they start with the carbs and get those dealt with, and then they go to their low carbs, and then they go to their proteins last, they will typically find that digestion feels better. Now, that's assuming they can take 20 to 30 minutes to eat their meal, because they've got to give those carbs a head start. And then they've got the buffer of the low carbs going in that kind of helps to push things through faster. And then the proteins can sit undisturbed in the stomach for the 2 or 3 or 4 hours while the stomach regenerates its acids really well. Chris says, so many don't feel heard when they see their providers. This explanation from an iridology assessment provides answers. Use enzymes that people rarely get from regular physicians. Absolutely. Absolutely. Now, if I'm working with someone who is maybe a little bit younger, and especially if they like to cook, I might not start them off with an enzyme or hydrochloric acid as a supplement. Instead, I might start them off with using more savory herbs in their cooking. I might say, can you add more dill or more sage or more basil or just anything? Add more flavor to your food, because flavor, again, gets that nervous system working to stimulate the juices. And even older people, if they're in a situation where they're still doing their own cooking, they often lose, their mouths are often dry, and that makes them lose their sense of taste. Right? So if we can get them to use more herbs and seasonings in their food to stimulate their taste buds, that can be very helpful. Herbal bitters are brilliant, Tony. Absolutely brilliant. And there's so many different bitters on the market depending on where you live. They can be very locally done, sort of the bitters that grow in a region, or you can get them from another area of the world as well. So yeah, herbal bitters are great, but I want them to taste those bitters. I want them to have those bitters in their mouth while they're swallowing it and not avoid the taste buds. The bitters will work if they don't taste, if the person doesn't taste them, but they'll work better if they do taste them. Okay. So again, when we're talking about digestion, often when we ask our client, how's your digestion? They'll start talking about poop. Well, that's elimination. That's not digestion. So then I break it down. I go right back to, how does food feel when it first hits your stomach? Are there any foods you've learned to avoid because fairly soon after you eat them, they don't feel good? That's how we start the conversation about stomach and educate our clients about digestion as opposed to assimilation or elimination. So this is a fairly new client to me. We just had our first meeting just a few weeks ago. Now, I like to see my clients about every 4 weeks for the first few appointments, but I also touch base with them 2 weeks in. I send them a quick email and just remind them of the things that we talked about and ask them how they're doing, so that if there's something that's really not working, I can tweak it before their next appointment and get them on a better track. So this is a client, female, in her 50s, she's 57, late perimenopause. Her last menstrual period was 2 months prior to our meeting. Did you know that perimenopause changes the biome? It changes the gut biome. Yeah, Amanda knew that. So good to know. And that is why so many women, as they're going through that perimenopause and into the menopausal phase, end up with digestive problems because the biome has shifted. And we're not talking just the biome in the large intestine, but the biome in the small intestine, the biome in the stomach, the biome in the esophagus, the biome in the mouth. It all shifts. So this client came in, and her primary concern that she wanted help with to start with, and she had a shopping list, but the number one was that she has amazing stabbing gas pains that are sporadic and they radiate into her back. She actually at times has thought she was either having a gallbladder attack or a heart attack. So she would go to urgent care. Urgent care would not find anything wrong. They would do an ultrasound, gallbladder's fine, heart is fine, go home, there's nothing we can do about it. But she has putrid farts. We're talking to protein farts here, right? Notice when you look at her eyes, she has comb teeth, right? She's got the comb teeth. And so she's got double trouble here because she brought in lab tests, which I love when clients bring in lab tests. Her prolactin is elevated to 57. At her age, it should be between 20 and 25. Super elevated. That's a problem here because elevated prolactin suppresses estrogen, and that slows gut motility, and that decreases bile production, and that further pushes the dysbiosis in the gut. So that elevated prolactin is a huge problem. And the doctors have not been able to do anything about it. Now, there are herbs we can do, but that's a discussion for a different day, right? So, oops, that skipped one. There we go. So I sent her an email 2 weeks in, and I asked her, how are things going? How's your digestion feeling? I want a progress report. And she said, hi, Judith, I'm happy to say those pills, we're doing betaine HCl with her, are doing the trick. I've been taking one at dinner and have been so much better. She's taking just one a day. So thank you. And she sent me her lab work as well, more lab work than just her prolactin. So she just needed more betaine HCl to get her going in the right direction. And that's great because we build up the HCl. What's going to happen there? We are going to begin reversing the process of digestion, getting her digesting better, so that when I come to address the elevated prolactin with her, we will have a much easier time of getting that dysbiosis under control. Does that make sense? Okay, how are you doing? How are you doing with this? Got some nods? Some goods? Okay, fantastic. Glad to hear it. This is a young boy, a 10-year-old. His parents brought him in. He was in the process of being diagnosed with ADHD, and they wanted to avoid using the medications with him. We did great for a couple of years, and then they decided medications would be the best option because he was getting into middle school, and that was too important. I broke my heart, but that's okay. They learned nutrition from me, and that's great. What we know about people with ADHD is they tend to not focus on eating. They're too distracted. They want to do a million other things, but eating is not one of them. And so we really had to work with him to get him to slow down his eating. Okay. So when we look, he has little tiny comb teeth in here. But he also has the nervous system markers that tell us he probably eats way too fast. He likes doing things, being busy, and he doesn't like sitting still. And so we had a lot of work to do. Who do you know that's like that, that doesn't like to sit still to eat? Alva knows people like that. Mm-hmm. Mm-hmm. Yeah, and Tony is laughing. And Tony, are you guilty that you don't like to sit still to eat? Okay. Shame on you, Tony. It can be a difficult lesson, especially, okay, I'm going to generalize. I don't know any of your backgrounds as far as family situation, but if you've got children, you learned to not sit down to eat if you had children, right? And even if you don't have children, you probably saw your mother not sitting down to eat. And so you learned that women don't sit down to eat. They eat while they're doing other things. I would challenge you, and I would have you challenge your clients. Literally set a timer, set it on their phone if they want, but then they have to leave their phone in the other side of the room to have them sit for 20 minutes to eat. No reading, no scrolling. They can gaze out the window. They can engage in pleasant conversation. They're not making notes on a notepad. They are simply focusing on eating and focusing on the ambiance. And they will gradually learn to love it. Kind of like someone who's a go-getter learning to love flow yoga, right? Same thing. So important, so important. This is a 4-year-old. Look at those comb teeth. She did not do anything to put those there. This is a little girl who, she's now about 11, a sweet, sweet young lady. One of my favorite clients to work with. She was an IVF baby. And again, I worked with her mom and her dad for about 3 years before they decided to go for IVF, when doing it naturally wasn't working for them. This little girl has had an amazingly clean diet. And she has inherited this chance of poor digestion. So we just always need to make sure then, and mom is very conscientious, that the whole family gets the right kinds of foods for who they are, right? And that will serve them very, very well. This was a fellow in his mid-30s. Tell me if you know someone like this. Notice that he's got a stomach ring and he's got comb teeth. He's got a double whammy. Very, very common to see that. He's had lots of gut issues most of his life. His mother was a client of mine, is a client of mine. And I've seen most of that family, most of her children and most of the grandchildren and her sister and nieces and nephews. As a child, he had very heavy antibiotic use. He really struggled with things like ear infections that would go really deep and be really hard to move. Even as an adult, he struggles often with candida overgrowth, and his diet is very, very clean. Obviously, his biome is out of balance. He has good, clean animal proteins. The animal proteins are always organic or free range, very, very low carb. Lots of the low carb vegetables, but he doesn't sit down to potatoes or French fries or things that are really high in carbohydrate. No alcohol, no coffee. I mean, we're talking a clean diet, but he is prone to excessive gas buildup as a general rule. And if he eats carbs, instant diarrhea, explosive diarrhea with so much gas. He does not do carbs well. We had gotten him cleaned up really well. He was feeling good. His digestion was feeling great. We were experimenting with expanding his diet a little bit, and he was doing really well with that. He's a land developer, so he has to do a lot of schmoozing, right? And so he had to be at a business function one Friday night, and I don't usually have my cell phone with me Friday night because I don't work evenings, but I had it beside me this evening, and he sent me a text and he said, I'm at this function and there's nothing I can eat. What do I do? And I texted him back and I said 2 things. If you had to eat something off that buffet table, what would it be? And number 2, do you have your digestive enzymes with you? And he looked at the buffet table and he said, well, I would choose these things. And I said, those are great choices. Those are going to be the least upsetting to your system. And I said, but you have to take your enzymes. You're probably going to take extra enzymes to get through this. So I want you to take 3 enzyme tablets as soon as you've eaten, and then gauge it about 20 minutes later. How are you feeling? And take more if you need them. Well, the next morning, he texted me and he said that even though he'd eaten some of these foods that he would have not have touched 3 or 4 months ago, he made it through the night beautifully. No gas, no explosive diarrhea, totally under control. Everything was good. And my response to him was, now that you know how to break the rules and get away with it, that is your emergency escape hatch. It is not what you do on a daily basis. It is what you do in a crisis. And he went, I got it. I said, so you never want to be without those enzymes in your pocket, so that if you're backed into a corner, you can get through it just fine, right? And again, this predisposition doesn't mean he has to have problems. It just simply means that he's more prone to them. And because of his background as a child of having used so many antibiotics before his mom learned about holistic things, his biome is really, really disrupted, right? And so that's where he stands. But I was so happy when he texted me the next day to tell me that he had gotten through the night just fine. It's like, yes, yes. How are you doing with this? Are you seeing any people that you know in some of these stories? Are these helping you to understand a little bit more about how to work with those clients? All right. This is a client who's been with me. Literally, she was one of my first clients. I think if I looked at her records, I'd find that she'd been with me for like 45 years. So she started with me when she was like 19 or 20. She was just about my exact same age, right? She's one who ebbs and flows. She'll come in for a few appointments. We'll get her feeling really good. And then she's doing great, but then things start to fall apart and then she'll come back. So she's been away for a while and she's coming back now because she has gained a ton of weight. She has gained 100 pounds. Her ideal weight is 160. She weighs 260. She's been diagnosed with type 2 diabetes, and she has a diagnosed issue with her esophagus where swallowing is becoming harder and harder. The esophagus doesn't do the peristalsis, and she often ends up with food stuck in her throat. It has to be tiny, tiny bites, well chewed. And she also feels like there's always mucus in her throat, which makes perfect sense, right? And when we look at her stomach, she's got the comb teeth, right? She's got the comb teeth. And the stomach zone, and this is a marker we're not going to talk a lot about today, is an entirely different color from the rest of the eye. So that teaches us about other organs that can impact digestion and make digestion more difficult for her. So inherently, genetically, this is what her parents gave her. And she did pretty well until she turned about 40. And since then, it's been a real downward spiral. So she has some reflux. The doctors had put her on PPIs and not explained that ultimately, and this is critical for someone her age, ultimately, because of the way a PPI messes with the stomach acids, it compromises bone density because it inhibits the assimilation of calcium. She's in her mid-60s. She already runs the risk of osteoporosis. She doesn't want to look that squarely in the eye and say, come, I want you, right? She wants to avoid that. So I asked her if she would be open to doing an experiment. Now, I can't tell her to stop a medication, and I will never tell a client to stop a medication. But I will present options where they can make decisions for themselves, and I will support them regardless of what they decide. So I asked her if she would be open to experimenting with putting the PPI on hold for just 2 weeks. 2 weeks is not going to make a whole lot of difference in the PPI. She wasn't feeling any benefit for taking it anyway. She still had the reflux. No duh, right? So instead, we added betaine hydrochloric acid to her, the exact opposite of what the PPI was doing. But we started out with a really, really low dose, like really low dose. And I gave her instructions. I said, you're going to take this really, I didn't say you're going to do, I said, I would suggest if you do this experiment that you start with just, one a day for a few days. If you're not feeling any different in any way, shape, or form, increase it to 2 a day, but polarize them 1 in the morning, 1 at night, always with food, always with protein. And I taught her how to basically build it up slowly. And about 2 weeks in, she was doing some more than 1 tablet with each meal. And she sent me an email and she said, my throat is feeling clearer and my stomach is feeling better. No duh. No duh. It drives me crazy. PPIs are doled out they're doled out based only on symptom, with no study being done, no scoping to see what is the acid situation in the stomach. There is so much more that I could teach you about digestion and the irides, and more markings and more organ interactions and more about the colors in the eye and their placement in the iris. We'll save that for the Dynamic Iridology Assessment System course. And there's just so much, so much. So key takeaways, I want to know, what is something that you learned today that was like, wow, mind blown? Or I always thought that was true, but now I get it. I've been validated. I want to know, what is your biggest takeaway today? I want to know that this was time well spent for you, is what I'm looking for here. What is your biggest takeaway? Give you a minute to type that in. I know it takes a few seconds. And then I'll share what I hope you gained. And that's not to say that what you've gained is bad or wrong or anything like that. It's just, of course, a teacher has ulterior motives of what they want the student to learn, right? And if you learned more than what I wanted you to learn, that is bonus. That is, can I say, icing on the cake when we're talking with nutritionists and health? Maybe, maybe not. What was your biggest takeaway today? The thing that you went, wow, that was worth the price of admission. And I can see some of you typing madly on your keyboards. I love that. That is so good, so good, so good. Perimenopause and menopause can change the microbiome. Oh, Renata, that is, yeah. Isn't that just mind blown? That we know that the biome can change literally within a day or two just from taking an antibiotic or a medication or whatever. Stress will change it very quickly. But perimenopause, the hormone balance, the undistracted eating has a much larger impact than realized. That the degree of digestion, stomach acid depletion with age. Brilliant. So you picked up a couple of things, Amanda. That's exciting. That's exciting. I think Tony is maybe writing a book for me, which is great. And she nods her head. Yes, yes. Okay. While you're continuing to write your book, Tony, here are some things that I had hoped that you saw as well. Several markings can suggest predisposition to insufficient stomach lining and stomach lining function. There's more than one marking that can give us that information. We covered two. There's actually a third one as well. Actually, when we put in the colors and things like that, there's many things that can teach us that. Tony says, can I say all of it? There's so many things I knew but didn't understand. PPIs are one of the most prescribed meds here in Ireland, and just that there are herbal and nutritional changes to make that we can speak to clients about. Yes, yes, and you can say all of it. That really is lovely. Thank you for sharing that. And if anyone else is still typing, I'll come back to the comments in a moment. Often the things that we see in an eye, particularly when we're looking at that stomach zone, point to the need for additional support based on symptoms, right? You can see the marker. You also need to have the symptoms to understand what you need to do with that. Sometimes magnification is required to identify some markings, especially the comb teeth. The stomach ring is pretty visible using just a handheld magnifying glass. Comb teeth, you might need a proper iridology camera, like a good 24 megapixel camera. Oops. Constitutional iridology combined with your existing modalities, nutrition, herbology, flower essences, whatever you do, aromatherapy, can help you create powerful client results. But you do have to have the conversations with your client. You can't just look at their eyes and be giving a cookie cutter program. Every time I see comb teeth, I give this, because it's never a one size fits all. And I think we all agree with that. There may be commonalities between clients, but there are no two clients that are exactly the same. So as the beloved Dr. Bernard Jensen said, after a meal, sit a while, then walk a mile. So I would like to take just a moment to introduce you to the Dynamic Iridology Assessment System for Health Professionals. This is where you will get even more depth and more breadth on everything. And so registration isn't technically open right yet, but it might be for the right people, and you could be some of the right people. This is the only live, online, fully mentored course for registered nurses, natural health practitioners, NDs as well. They should be on here, functional medicine practitioners, anybody who wants to streamline their client care, their clinical work without sacrificing the quality of work they do. And you want to do this because you want to be able to create your programs quickly while you're with your client without writing lengthy reports outside of clinic hours. You don't get paid to write reports, people. You don't charge enough for that. I guarantee you don't. And so if you can get your programs created while you're with your client, it means your programs will also be simpler, and your clients will be able to stick to them better. As they stick to them better and they get results, it improves client compliance. They want to come back and tell you that this worked. What do I do next? If they can't do the program, they're not going to come back and say, I couldn't do it. I failed, right? If you want long-term retention, you want simplified programs that are very client specific. And iridology, dynamic iridology, can help you with that. In dynamic iridology, we cover the constitutions, we cover the constitutional and structural subtypes, we cover the different iris markers, contraction furrows. There's, I think, 9 different types of contraction furrows we talk about, pigments, digestive system markers, and so much more. And we teach you how to integrate it with what you do. So the next course start date is September 23rd. And you can grab the URL here. I didn't put that where I can grab it easily. So take a screenshot or grab the QR code here. We also teach you how to group the markers with real symptoms instead of using cookie cutter approaches. Clients are looking for individual work. I think it was Chris who said that. Clients don't feel heard by their practitioners. Can help us to build effective client-friendly protocols in minutes instead of hours. So see more clients, increase your income, but your clients still feel like they were the most important thing in that time you spent with them. That's how they need to feel. Iridology is an assessment tool. To be truly effective, you need a modality with that. You need nutrition or herbology or aromatherapy or flower essences. You need something to work with it. Otherwise, you can tell them what's maybe broken, but if you can't help them fix it, who cares, right? They need to know that. And receive ongoing mentorship and community support. How many of you have had the experience of taking a course, and at the end of the course, the door was slammed shut, there was no more support? Many, many times, and many thousands of dollars worth, right? Even after you finish the course, there's ongoing support for you. The door will only get slammed shut when I decide to retire, because everybody needs to retire sooner or later, right? So the course is taught by 20 2.25 to 2.5 hour live webinars. Interactive, you'll have your cameras and mics open so we can actually have a conversation. It includes all of the curriculum that IPA requires to prepare you for certification. And I teach implementation. I teach how to create protocols. So if you're a herbalist, you're going to learn how to integrate the herbalism. If you are a nutrition coach, you're going to learn how to integrate the nutrition. And maybe you're a herbalist who doesn't have nutrition. Guess what? You're going to pick up some nutrition anyways, and vice versa, right? We meet once each week, very interactive. I share my 45 plus years of experience, including nutrition tips, herbal info. Students get to ask questions. We have conversations. We hold 2 live mentoring sessions every month as well, in addition to your classes that you're invited to come to just listen to what other students are talking about and getting support with. You can bring cases, you can bring business questions, all there to support you. And even after you've completed the course, those mentoring sessions are still open to you. I only take 10 students per cohort because it's really important to me that you get the individual attention you need. Over the course of the entire program, you will have 6 invitations to meet with me for one-on-one mentoring. Most teachers actually charge to mentor you extra, and almost all of the IPA instructors charge to mentor for the IPA exam. I don't. It's included in these 6 one-on-ones that we do, right? So if you've already got your college level anatomy and physiology, then you are prime and ready to enroll in the Dynamic Iridology program. So if this sounds like something that you want, that you're excited about, then I invite you to book a Zoom link with me. I'm going to share that, book a Zoom meeting with me, and I'll share that link in just a moment. I don't have this, it's not available to the public, and the registration link is never on a public facing page. You have to meet with me in a Zoom meeting to get access to the registration page, because I want to make sure you've got the A&P. I want to make sure that we are a good fit for each other in this program. Have you ever enrolled in a program and you got in there and you went, I can't learn from this teacher. I don't even like the personality. It happens, right? And that's sad, because then you don't learn as much as you could. So I want to make sure that our chemistry is good. I want you to get the best bang for your buck. You're going to find a lot of iridology courses ranging from $69 to $3,300 US. And I've had students come to me having done all of them, and they still tell me that they couldn't do iridology. That's why they came into my course. And this is one of my grads. This is what she said. She had done, it was her first iridology course. She had done the CNHP program, I think through Trinity, and they had a 3-hour lesson in iridology. A 3-hour lesson. Yeah, that's not going to take you anywhere. That lecture and the study material left me more confused than I was than before I knew anything at all. Judith's Dynamic Iridology has been an incredible experience, and we are just halfway through the program. Her teaching materials are thorough and easy to follow. The charts are invaluable and so insightful. I left Western medicine a while ago. She was a registered nurse for 22 years. Western medicine couldn't help her with her health, but iridology has helped her to identify many of her own health challenges and to support her body better. I have also been able to guide my family, she says, in supporting their bodies. Judith is truly amazing and is my most favorite instructor. Oh, melts my heart. Out of all of my many years of higher education. Brilliant. So here you go. If you are interested in priority notification, you're going to grab this. And again, I apologize, I didn't put that where I can use it. You are going to grab this tinyurl.com/eyes-priority. That will let you know when enrollment is open, or you can grab the QR code. If you want to see more information about the course itself, you can grab the top URL, iridology.education/course-info. Or again, you can grab the QR code. They will take you to the very same place. So I hope that you now have a much deeper understanding of at least these 2 iris markers. And I hope you can see how you can use those maybe with your very next client. If this resonated with you and you're a health professional and you want to dive deeper, you want to do the Dynamic Iridology course, you can absolutely grab one of these links and we can be in touch and see where it takes you. And I want you to know that I'm really, really glad you were here today. Thank you for being here. Thank you for your interactions. And I look forward to connecting with you personally in the very near future. Any other questions before we say goodbye? Any other comments before we say goodbye? Are we good? Looks like we're good. You are all most welcome. It was great to have you with me. And you're welcome, Wing. Good to have you with us. Have a brilliant day, and we'll talk to you soon. Bye for now.